John, there's this new research from the University of Oregon showing that when teens feel a strong sense of belonging in their community, that can make just as big of an impact on their mental health as medication or therapy.
I struggled with wanting to disappear, but never really wanting to die.
Aditi Kanana is a senior at Westview High School in Beaverton. She's been battling with anxiety and her mental health since 7th grade.
I didn't want to have to deal with the day-to-day life stuff. I didn't want to have to deal with issues with my friends. I didn't want to have to deal with getting out of bed in the morning.
Things started to look up for her when her mom suggested she go to therapy and start taking medication.
I would just kind of wallow when things got really bad, and I would just let it kind of consume me. And now it's if I'm having a really bad week or I'm dealing with a lot of anxiety, I can take some time in myself to be okay, I know what I need, and I know I need to pull myself out of this.
Now she's pulling others out of the same dark place, working at Youthline, a national teen-to-teen crisis support line. The CDC says 20% of U.S. high schoolers have had serious thoughts about suicide. Lauren Burney from University of Oregon analyzed data from a group of almost 300 high-risk teens. She found social connections in schools and in their community lowered the risk of suicide attempts.
It's not just receiving clinical health treatment. It's also feeling supported and feeling belonging.
Burney also found strong social connections had the same protective effect for survivors of sexual and physical abuse or teens with disordered eating. She says schools can help foster protective relationships through peer support groups or mentorship programs. Anna Catherine Scroy also works for Youthline.
You might have to look a little hard and find a group of people that you really connect with, but it's very likely that they are out there.
Now, Youthline has people ready to help and provide emotional support. If you or a teen you know is struggling, you can reach them at the number listed on your screen, 877-968-8491. John, back to you.
Sydney, thank you. Very brave of them to share their story. If you or someone you know is in crisis, help is also available through the National Suicide in Crisis Lifeline. Call or text 988. It's available 24 hours a day, 7 days a week.